Hello, Mathur. So, yeah. खाना भाई हाँ वही काम से no problem हाँ te कोई दिन also कोई किलो मकाज़ो करें हाँ
Thank you.
Namaskara.
Sir, very good.
Afternoon. Coffee aita? Had your tea? Hello.
Very good afternoon, sir.
Start ಮಾಡೋಣ ಒಂದು 2 minutes ಹುಡುಗರು ಜಾಯಿನ್
Okay, take sir, please take your time, sir. Okay. Fine.
ಲೋಪೋ ಆಂಟನಿ
ಹಾ ಸರ್
ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದಾ?
ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಸರ್.
ಬಂದಿದ್ದಾರೆ
ಏನಾಗ್ತಿದ್ದಾರೆ ಸರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ.
Yes, good. Huh? Catch it. Huh? Yes, sir. थोड़े दिन catch me for nose good. Hello. Go.
Doctor will start the session. Good evening, everybody. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. We have with us eminent surgeon.
Sir, ECG kara.
With us eminent surgeon Dr. Deepak Chavan. Doctor is a laser, laparoscopy and robotic surgeon. Presently is associate professor and IT chairman BND University, and also president of Sainik School Old Boys Association, and also owner of Seva and Banjara Hospital. Doctor was born in the teacher's family. His father was a deputy director of PU board, and mother was headmistress in a government school. Let me give a brief overview of his educational and professional experience. Dr. Chavan did his MBBS, then masters from Bangalore University. He also holds many fellowships, FMAS, DMAS, FAIGS, FAIS, and presently is working as associate professor. He is the recipient of many awards, including Mother Teresa Gold Medal Award in 2012, Gold Medalist in Advanced Laparoscopy and Robotic Surgery from the World Laparoscopic Center. He is also a recipient of Best Teachers Award in 2021, also Best Research for Thesis Award from Rajiv Gandhi Health University, Karnataka, and he is also a recipient of COVID Warrior Medal. And regarding his research publications and innovations, he has published 7 national and 4 international publications. He holds 2 patents to medicine and also 4 innovations. And he also has 2 startups. Not only that, Doctor is a multifaceted personality. He is also a good sportsman. He university sportsman. He was also interzonal football player and also a Ranji player. I'm sure all of you know Ranji, and a national swimming champion at national level He has also he also has participated in cultural and social activities. He, Doctor was a judge in a fashion show for 7 years, and he is the founder of Sahas NGO charity, and he also has adopted a village and participated in Republic Day parade as an NCC cadet. And he is also a member of Tiger Census of India. Doctor will be delivering a talk on recent advances in surgery. ನಿಮ್ಗೆಲ್ಲರಿಗೂ ಡಾಕ್ಟರ್ ಚವಾನ್ ಅವರ ಉಪನ್ಯಾಸ ಬಹಳ ಉಪಯುಕ್ತವಾಗುತ್ತೆ. Some of you aspire to become doctors. Please listen to his talk carefully. I'm sure some of the points will also appear in NEET exam for you. With this brief background, request Dr. Chavan to deliver his talk. Doctor, to you, and once again, welcome to you from KSTA for this talk.
Thank you, sir. Thank you very much, sir. Thank you, Mr. Ramesh, sir. I will not waste much of your time. I'll go to the topic directly. Let me introduce to my best, I chose this surgery because I always love to do surgery on the patient to save life since the beginning. Uh, Let me go to my signature slide. I owe gratitude to all the teachers because of whom I'm here today. And without teachers, I wouldn't have been here in front of you what I am. They are my sports teachers, they are my academic teachers, and teachers are the one who guide you. And because of them, I'm here today. My topics are in the form of introduction, the history of surgery, how it began, and what all the advancements have taken place, not only in the surgery, even in the field of medicine. So I'd like to show you what all things have happened, how fast we have grown, and how best the technology is supporting for the treatment of the patients. So let me go to the introduction. Everybody would like to become one or the other in future. Somebody wants to become a doctor, somebody wants to become engineers. It is not must and should that these things has to be dwelled within. Somebody should not encourage you to become like this, take this course or that course. You yourself have to choose which course is best for you and enjoy that course. That is the best thing. But taking a course which you don't enjoy is of waste, what I call it as, because nor you like it, nor you put your 100%. Ambition versus reality. A person is happiest when he chooses a job that he loves. Let it be any job, right? But you will progress in that job when you start loving it, what you're doing. So, definition of a surgeon. A surgeon is the one who has the lady's fingers. That means that he should be very soft and gentle when he is touching any part of the body of anybody. It can be deceased or non-deceased. A lion's heart to remove the cancer or remove the tumors or swellings. We need to have a lion's heart because there will be bleeding will be there. There will be many other things will be there. And you should have eagle's eyes. You should know what exactly you are taking out from the body, and you should know what it is not. If you do have all these three qualities, yes, you can become a complete surgeon, right? And this holds good for each and every other professional courses also. When you go to the wide scope, the surgery has a very wide scope. See, somebody says that surgery belongs to only one organ. No. The surgery you can do all the surgery related to your gut, that is GIT. Surgery can be done on the brain, you can become a neurosurgeon. On the heart, you can become a cardiothoracic surgeon. On the on the endocrine, you can become an endocrine surgeon. So there are many things which you can opt for. No, I am very much interested in pediatrics, that is children's. Yes, I can go ahead and do pediatric surgery, and I can do the surgeries on the kidney. And the best is the plastic surgery. You might have seen in the movies that in the initial movies they'll be having a different type of nose, but later on they correct their nose, and the film, especially the heroines, becomes more attractive. So that is the magic of plastic surgeon, what they do in the operation theater. So let's, as a surgeon, what are the benefits? Yes, there are many benefits of being a surgeon. I'll not go much in detail about these slides. And there is a risk of being a surgeon also. Yes, you have to have a skill and practice. Without practice, you cannot be a surgeon, right? And age is another limiting factor, but now the age is not at all a limiting factor because of the technology which is supporting the old surgeons also can operate now. Now let's go to the history. What was it before, when before surgery evolved? How the people used to do suturing and other things? You can see in this, mother is suturing the wound for his baby. She takes the ant, and ant bites the wound, and there is approximation of the wound, right? You can see now there's an ant, and later she'll throw the neck of the ant, and there is approximation of the skin. Normal. So this is how they used to approximate. Later on, it came the era of sutures, the era of threads, what we call it as. Different types of threads started coming. And now we have stopped using thread, not completely, but yes, inside we use thread. But outside for the skin, we use staples. Okay, these are simple like how you do paper stapling. These are the stainless steel staples that we use right now, okay, to approximate the skin. So from ants till today, how there is advancement has taken place. The second approximation of the skin is through glues. You can see this is a glue, like, okay, glue in the sense, the gum, you can call it in your terms. See, this is a glue which is used to approximate the skin, right? And there precisely the approximation is so good that after some years you may not see that scar mark also. What used to happen in the earlier days whenever there used to be surgeries, the surgeon used to come with their, it was like a festival. He used to come with his favorite blazer or gown or coat, and he used to operate on the patients. He used to tell the sister, come with the pretty dress. That was a celebration, and they used to do the surgeries in this fashion. But now you see the advancement because of the sterilization, because of the infection. You see, everything is covered from the top hairs till the foot is covered. The surgeon's this thing is covered, and you can see the Spider-Man. This is the latex gown that have come in the market. You might have seen even in case of Corona, but generally in Corona it is PPA kit. But in the operation theater, we use the latex. These are latest dresses, and those will prevent a lot of infections and cross infections too. In olden days, everybody should know about Shushruta. Remember this Shushruta, and it's also, I'm surprised to see that there was a question regarding Shushruta in one of the entrance exams. And Shushruta was the surgeon, the father of surgery and father of medicine, right? He was the one who invented and there are others who contributed for surgery in a lot many ways. They operated on pancreas, they operated on stomach, they operated on different glands, and they gave us the best feedbacks, and you can say the boon. Now still we are advancing ahead of what used to be happen in previous days. Shushruta, he invented many things. He invented instruments. He invented, the type of surgery. And the best punishment they used to get in olden days was to cut the nose. Why they used to cut the nose? Is other person should recognize that this fellow has done some mistake. This fellow has done some, uh, he was a thief or something. They used to cut the nose. Once the nose is cut, where the person has to go? So, in search of some person, the people started migrating, and here was a person. Shushruta ji was the one, the doctor, who used to operate on these nose and used to correct those noses. It was such an interesting thing that people walk from Afghanistan, China, and other parts of the world to him to get operated. He became so famous, he started even operating on brain also, right? And you can see all these instruments were invented by him and the books written on him. And see, these are the instruments which were invented are modified, but the invention is from our ancestors. Now, advances in surgery, how much advancement has taken place, and with the help of the technology. You see this video. See, this video was in the year 1999, okay, when I was small. And when this video came, majority of the people started laughing. How can it happen? This is uh, the English movie, okay? And they said, how can this happen? They leave the insect inside the patient, this body of the hero, okay? It remains inside and it controls whole body, right? This movie is Matrix. If you want to watch, please watch it. It's a very good movie. Later, the friend of this hero, she the friend of this hero, she removes this worm with this instrument. And in 1999, everybody said, how is it possible? What she did? What was it? You know? And, many of the non-doctors, they said, this is all, English movies, it is shown, but nothing will happen. But I will show you now in my next slides. These all things can be done without any scar. You can remove any of the pathology or any tumor or any cancer from the bone. Now you see the worm comes inside, right? And she throws it away. Without operation, and in the sense, it's a type of operation, but without cutting the bone. So you can see how best the technology is helping the surgery. I will show you what are the methods. I'll go a little fast in this. You can see the newer layer of surgical techniques. Yes, these are all your MCQ questions. The first is endoscopy. We put the tube inside the mouth and to do some surgery or to see what is there, what is not there. Robotic surgery, here we use the robots for the operations. I will show you that those robots also here. And laparoscopic surgery, here we put the scope. Scopy means what? To see and operate, right? So here also we put the scope and operate on the patient. I will show you how they are. You can see here, this is a laparoscopic surgery. The surgeon is holding the two, surgeon is holding in these two hands, right? In one hand, he's holding one instrument, the other hand, he's holding the other instrument. And you can see in the TV that this is 40 times bigger. You can imagine whatever he's seeing, it is 40 times bigger. So, bigger in the sense you can see more precise, more clear, and you can do surgeries with a sharpness, right? And more advancement in this is you can see the surgeons are wearing goggles on their eyes, and these goggles are nothing but 3D. We have moved ahead. It is not just a laparoscopy, it is 3D laparoscopy. It means that the image appears just in front of you and you start operating, right? This is laparoscopy. Now, next is this is robotic surgery. You can see here there are robotic arms, okay? And here the surgeons sit in the console in the chair very comfortably and they operate. They need not to stand and they need not to, strain their body. This we call it as notes. I'll show you all the videos also, need not to get confused. What is notes? This we call it as natural orifice transendoscopic surgeries. In this, what we generally do is without holes. If somebody thinks that they want surgery to be done with the smaller holes, the best will be laparoscopy. If somebody says, I don't want any hole on my body, especially the film stars, if you have got professional some problems, they say, I don't want any scar or I don't want any marks on the skin. Yes. Now you have got these surgeries like notes. Here you can see the endoscope has been put from the mouth. It goes into the stomach. They make small hole in the stomach and they go to the gallbladder and they operate. Bipasha Basu, the film actress, she has undergone cholecystectomy, that is gallbladder removal excision, through these surgeries. This is through mouth. Even you can use through the rectal route also. You can enter inside and you can operate on the patient. So here you need not to cut any surface of the body or anything, right? So this I'm showing you some of the video clips. This is laparoscopy, the 40 times bigger you are seeing. Okay, the content is 40 times bigger, and you just here they are clamping the cystic artery. I'm not go much in detail. I'm just showing you how the laparoscopy will look. Just remember the name laparoscopy, right? Sorry. Now going to the robotic surgery. Here you see the robotic surgery. The robots are stitching, but the orders are from the surgeon. You can see lower down so nicely the surgeon is uh, manipulating the fingers and he is stitching. Okay, and this command goes to the robotic hands, limbs, and robots are stitching. You can see this is the surgeon who is operating, and this is a robot. Okay, which is doing the manipulations, right? Now I'll tell you the best part of the robot. I'm sitting in place called Bijapur and I'm operating on my patient, and suddenly I will get stuck. I don't know what to do next. I cannot remove this tumor. So I can call a friend who is sitting in US or UK and I can tell him that I'm stuck in this surgery. Then he goes to his console. Okay, it is like playing a game. He sits there, he connects to the patient, and he can operate. What I told you, yes, this is the best part of the robotic surgery. Sitting anywhere in any part of the country, you can operate on one patient. You can see this. The other surgeon is taken over, and this surgeon has stopped, right? So, two people, three people can operate on one patient. No? So, this is the beauty of the robotic surgery, right? Okay. So, you can see this how they are suturing through the robotic arms. The best part of these robotic arms is it can rotate 360-degree in all the directions. Fine. The best part I said about the age. In the robotic surgery, mainly the old age people can nicely operate on because they'll be sitting one. The second thing the robot does is it eliminates the vibrations. If you are having the vibrations in your hands, it eliminates that. Even if you have got strain, suddenly if you come out of the console, the robot is going to inform you that you are tired, so take rest, so I will freeze the system. So user friendly the robot is, it can understand the body language of a surgeon, right? So old age people can also operate with robotic surgery, right? These are my pictures when I was doing training in robotic surgery. So this is a robotic console, robotic hands, and next go to notes. So what is this notes? As I told you, there is no sutures at all. There is no even the single line won't be there, right? So generally, what they generally do in the notes is you put either go through transvaginal route, transrectal route, or oral route. You put the instruments and then you are doing the surgeries. I'll just show you how they are done it. Here it is transvaginal route, and through transvaginal they'll put a, scope and they'll see it. And once they see it, okay, now you can see there is a scope which is coming inside. This is a uterus, what you're seeing. Now you can see, yes, this is the vaginal Yeah, this is a scope that they've introduced. And through this, they operate on the pathology, right? Next, I'll take you to some of the best technologies that we have around to kill most of the cancer cells. They are gamma bar cyberknife radiations. See, these are the machines. Really, they are very supportive to doctors, because in many of the cases, these, if there is a brain surgery, if I do extra removal of the brain tissue, then there is a damage to the body always. So these are the gamma knife radiations. They accurately they destroy the tumor cells in the brain, even in the pancreas. Okay, and they generally, you can see, now you can see this gamma knife. Okay, they are fed with the MRI reports. Okay, and they know where is the tumor, the accuracy of the tumor, and they burn the tumor. So see, you can see in all the directions they burn, and there is likely any damage to the normal tissue. Okay, but if you open and then we try to remove it, there might be a damage to the normal brain tissue, which may cause problem in his body. So these are the gadgets which are helping the surgeon to the very best extent. Next, going to the laser surgery. I'll not go much in detail. Yes, laser is used now everywhere. It is used for your varicose veins, cosmetic surgeries. It is used for hemorrhoids, right? So many where the lasers are being utilized, and even I'm doing a research on laser. Okay, so this is the laser which we generally use, and it is me operating on a patient. Now coming down to technology, how the real tech, that is what we use in and around, and what are the meditechs are there. The technology for medicine, it's advancing, and it is, I can't use some medical terms because I'm just restricting myself not to use some higher medical terms. Okay, so you can see this watch. Everybody might be having this sports watch, or we can call smartwatch. These smartwatch are going to revolutionize in future. Tomorrow, every school may give you a smartwatch, and those are the one which will identify your location. These are the one which will take your attendance, and they are the one who is going to monitor your health status also. You know, so most of the watches right now, even some of the cardiac patients who are very much ill, we give them these dynamic watches which will be monitoring their heart rhythm. If there is some changes in the heart rhythm, they intimate the doctors. Immediately the doctor will get an alert saying that there is some problem in the patient's rhythm. Then we call the patient and tell that there is a problem, you consult the doctor. They have become so so much importance today, that there is advancement, and even ECG also right now. You can program it. Atrial fibrillation, that we call it, as some of the cardiac conditions. We can even get such reports in this. We can check our saturation, oxygen saturation in this. In COVID, most of the patient have checked their oxygen saturation in the watches, and they report to the doctor. And if it is connected to the doctor's app, then definitely these are the watches are going to send to the doctor about the reports. Second, going to some of the diseases are very difficult to find out, especially the diseases related to small intestine, because you know that the small intestine is small, and the second is it is coiled lumen, so we may miss some of the pathologies. In such situation, there was an invention of capsule endoscopy. Yes, now it is being used regularly. And these capsule endoscopy will give us a picture within the small intestine as well as for the large intestines. What does it do? You can see in this video that the capsule endoscopy, you can see this is capsule which is going. It's like a small, capsule, right? What we take it, we have to just need to swallow it with the water. So it moves around, and see, you can see it takes 360-degree dynamic HD pictures, right? And these pictures immediately transferred to the doctor, and the doctor is going to see and he's going to diagnose upon key what has gone wrong in which part of the small intestine there is problem, and later he can decide upon what surgery that he has to do on the patients. So this is a capsule endoscopy. Coming down to the heart rate, yes, now the inventions of banyans as well as the t-shirts has been done with the ECG leads, and the patient, the person who wants to do gym, initially you might have seen some of the fittest people have died after doing the gym. Yes, because they have not regularly monitored their heart rhythm as well as the heart status. So these are the ones which can prevent these damage. When you're doing a gym, the warning message will come from your mobile saying that you are doing overactivity. So please stop this because heart is getting overloaded, right? So such things can be prevented with this, these type of jackets as these types of t-shirts, right? And these are our inventions that we have done during the COVID, where you need not to touch the patients at all. The patient has to touch his chest, and you can see that the heartbeat can be recorded in the mobile, as well as you can send this to a doctor who is sitting somewhere else also. So such type of inventions are also there. So if patient cannot come to a doctor, these gadgets can do the work very much fine and to the best. I will take you to one YouTube link where it will show you this. So in future, everybody visit with mobile, and this is what happens. What now it's an era of reaching the people as fast as possible. You can see this. This is a drone which carries the medical equipments with it. He's having a subject to heart attack. They termed it as an ambulance drone. Okay, so location based, it has reached. Pull the green lid. Now place the pads on your father's chest. So it just put the chest leads on the patient's chest. And now this is called defibrillation. Now it will be taken over by the doctors and they'll give the shock, right? And with this, the patient recovers, right? So such technologies are going to enter the market in another year, right? Okay, and it has entered only because of some of the location-based problems. It is not had been tested in India, right? Next is the AR, AI, and 3D. These are the one which are helping the doctors to a very, very, very uh, best extent. That is, you can see this in this patient that there is a swelling in the back. And what we generally do, we take a 3D picture of this patient. We remove, or before taking this swelling, we tell him where we take the incision, how big the incision will be, and after that we show him the specimen, and specimen also is recorded. After many years he may come back to us, and we that time we will show him that there is this swelling which was there, and this goes into the medical records. So one is for the medical records, second, pre-counseling of the patient, third, it helps in post-operative follow-up also. Okay, so like this we have so many other patients also. Okay, now the best thing what we have incorporated within the medical practice is the artificial intelligence. Yes, it is going to take over most of our burden in coming future. In the future, I'll give you one example. If you go to a scanning machine and if you get a scan done, immediately the scanning machine itself will give you the report saying that this is thing has happened to the patient. So the doctor is going to just say, yes, the mod machine has given the report, is it correct or not? You know? And even some of the doctors may have some confusions, and this AI is going to eliminate those confusions in future. And it has been started in ophthalmologic care, it has been started in orthopedics, it has been started in CT, MRI, even in the ultrasound level. So in another 2 3 years, it is going to boom, and it's going to help most of the doctors as well as for the patients to diagnose and for the betterment. We the doctors in the tech, we have, you can see he is my close colleague. You see, we open the system, they do play, we invent, and I'm very much fond of technology. I don't think doctors only treat the patient. Yes, even we know to treat our machines also. So you can see one of the pathologists here who is, correcting his lens, and he is a pathology student, right? And you can see this is a clinical data, what we are filling it, so that the digital data is the one which is going to remain with the patient throughout their life. If there is no digital data, tomorrow you may throw your whatever the patient doctors has written, and you may think that it's old, but sometimes old data is going to help us a lot in treating the newer patients, right? Innovations and research. See, the data what you uh, store is going to help you for the research, right? If you don't store the data, what you have done, it will really be a different kind, right? Once you store the data, these datas are going to help you for treating many patients in future. Coming down to that, I'll wind up my slide by saying my take home message is you transform yourself from a blackboard to motherboard. If you transform yourself from blackboard to motherboard, because motherboard is the mother of all the technology, every gadget has its motherboard, and this is going to serve the thing. If you're buying any mobile or any gadget, make sure that how much. See, I've seen many of my students who buy a high grade phone, but they use only for the WhatsApp and calls. Please, that's not should not be there. It is meant for your studies, it is meant for your research, it is meant for many other things, right? So if you're using only for that, then don't buy such gadgets which you are not utilizing to a fuller extent. I'll just go through what I was. If you like technology, yes, tomorrow there is the word for you. Okay, if you dislike, then you will go a little behind. But yes, you have to be with the technology. You have to be with the world right now to progress in future. And storage, always make it in soft. Hard, I never like it, because as you know now the trees cutting and other things, go green is the best solution. You can store all your datas in a soft copy rather than taking a print and storing it away, right? So what I want you all to go green and use your technologies to better extent, but don't get addicted to the technology, right? Okay, thank you very much, sir. If there are any questions, I'll be happy to share, and I'm sorry I was not well, but I could manage. Thank you.
Oh, thank you very much. In spite of your ill health, you could give a wonderful talk. In fact, it was a very scholarly talk, and we were not aware of many of the advances in surgery. Because of your talk, we could get many things, and I'm sure students would have got a lot of take-home messages, and some of your inputs would be very useful for them in their NEET or other exams. In fact, I was very much impressed by the way you started your talk, right from how to respect your teacher. That's really a great thing. All the students, all of us should really emulate that. We should respect our teachers and parents. Only because of them we are here and we are doing our work. As students, this is the first take-home message you should all really think over. And secondly, you said about enjoy the course. That's very important. Many a times, even if they are not interested in engineering or medicine, their parents will trust them to go to the course that they don't like. And this is a very important thing that you should take. This is a very important take-home message. You should join the course which you like. Only then you can really do something wonderful like Dr. Deepak Chavan. Your talk was really very inspiring, Doctor. In fact, I told all my colleagues to join and listen to your talk. They were all very happy to listen. And if you want to become a good surgeon, as doctor told, you should have a lady's finger, lion's heart, and eagle's eye. Only then you can become a good surgeon. You talked about how surgery was developed right from ants to now advanced things. And I'm sure that regarding jackets, doctor, I have a question. Are there any jackets to monitor our own health right now, or they are being developed?
No, sir. They are there, sir. Still, they are there in the market.
Oh, I see.
They are linked with the mobile app. They are there in the market, sir. Now we are only giving such jackets to the people who are having heart diseases for the monitoring of their health. If at all, if you want to have those jackets, you just tell me, sir. I will get it done. Only thing is, you have to link to some doctor there, so that whenever there is something goes on, you just have to pass on the report what you get it in a mobile. The doctor is going to take over. Lately, he can tell the things. Yes, that jackets are available, and we generally recommend such jackets to people who travel, especially whenever you travel to higher altitudes, like when the heart patient goes to. Recently, we have seen, yeah, many of the people recently went to the Himalayas and other areas. They start getting breathlessness and other things. So this becomes very easy for the doctor to monitor his health. For such people, we recommend to carry these gadgets, sir.
Umesh, are there any questions? Doctor, as of now, there are no questions. If
Thank you, sir.
students ask any question, we will be passing on to you for your kind reply.
Yes,
Really
thank you, sir.
great talk. We'll be inviting you again for next batch of
Sure,
students. Thank you very
sure.
much.
Thank you, sir. Thank you very much. Thank you, sir.
Students, thank you very much for being with us on both the Cisco WebEx and the YouTube platform. I'm sure Doctor's talk was very, very impressive and excellent. I'm sure all of you would have liked it. Please send your questions or any anything related to this talk. If you have anything to say, please share with us. We'll be sharing with our Dr. Deepak sir. He will be answering. Thank you very much.
Thank you, sir.